I was born in Kibera, stayed all my life here. Life is so challenging here. I can't say I was a bright student, but I think nile pressure ya teenagers. I met this guy and we were so in love. In the process, I got pregnant. I had to drop out of school and take care of the child.
The Health Literacy and Behavior Change Project in Kibera was a collaboration between Ministry of Education and UNESCO with the support from the government of Azerbaijan. It focused on the issues that relate to adolescent girls between the age of 10 and 19. And Kibera, being an informal settlement area, was a place of interest. There was a noticeable trend of high dropout rates among adolescent girls because of a number of issues, one of them being early pregnancies. Others would drop out of school as a result of drug-related issues. We wanted to know what really is affecting the girls.
From the very tender age, if the child is not prepared, nourished, and given access to health facilities, it would impair learning. UNESCO's role in general is about, really helping to build standards and norms. There is also capacity builder. And in anything we do, we'll try to look at how can we build capacity that would address the issue. And this is a project where there has been real engagement with government and government institutions.
The main role of the Ministry of Education was to offer policy direction and guidance. But we also brought on board our colleagues from Quality Assurance and Standards and the Kenya Institute of Curriculum Development, because one of the deliverables of the project was coming up with instructional learning materials that would help in mentorship and guidance and counseling for the girl child. This project targeted the public schools as well as the non-formal schools or complementary schools.
It's health education, and we need to ensure that there are materials relevant to the kind of information awareness that we want to create. But it's also important to provide the guide for the teachers that will be using the material.
The Ministry of Education first engaged the master trainers, and in engaging with the master trainers, we brought on board specialists in health literacy.
We moved in and tried to see the key issues that made the adolescent girl child miss school, even as far as having a one-on-one talk with the girls, and that's where we commenced on the journey to the making of the materials for the project.
Kenya Institute of Curriculum Development is an agency of government, and they have the mandate of vetting all materials that are developed for use in schools.
We look at content because we want to ensure that the content is appropriate for the level of the learner. We also want to ensure that this content does not have factual errors, that there are no typographical errors, there are no editorial errors because they are being used by learners. We also want to ensure that the content is current, that you're not giving statistics or you're not using terms that are outdated.
It is important when the teachers are involved because it is the teachers who are going to implement. And when you develop something and you drop it down to somebody to implement when it was not there initially, sometimes it becomes a challenge.
We adopted the cascade model where you get to train the master trainers, then they go down to schools to train the teachers.
As a master trainer, we use facilitation as the main mode of training as opposed to lecturing or any other system. We give the teachers the materials, they go through them, they discuss, they present, then we guide them in accordance to the education policy and the way the objective of the material requires us to do.
The instructional learning materials that we came up with were both print materials as well as audio. In some cases, the children were able to come together and perform short plays and poems that were educative in nature. And this material was evaluated and vetted before being proposed to the ministry for approval.
When we talk about gender, it's not only about the girl child. And it's good that in sensitizing girls, the boys are there. It's like a check for the girls, and it also helps the boys to be aware.
Sexual health information ita bring more change because kwa mashule zingine hawako na hii information. So vijana walikuwa na misbehave, wa abstain. So hii information itawasaidia sana. Jua hakuwa najua.
We have different subjects where the health literacy can be used, like social studies, religious studies, science, and life skills. Teachers, I think, will find it useful to incorporate that in teaching some of the subjects.
All the teachers who are going to get involved in this are going to work together with the parents to guide the child so that the child feels that it's taken care of from both ends.
This is a project, but going forward, it needs to be a program, ensuring that there is a more integrated approach for social inclusion.
And we'll look into possibilities of scaling it up based on the success that will have been recorded in Kibera to other parts of the country. The ministry's intention is to say that there is no child left behind in our education reforms, and that we are able to cater for each and every child.